Hi, my name is Katherine Cummings, and I'm going to be demonstrating a Foley catheter insertion today. Okay, so first thing we're going to be doing is I'm going to verify the orders to the patient and the patient's allergies to the patient and to the orders. So I have my orders here, and I see that Anna Pawlowski, who has an allergy to penicillin, who was born 5/5/57, has orders for an indwelling catheter insertion. So now that I see that, I can go into the room and begin. So, hi Anna, my name's Katherine, and I'm going to be your student nurse for today. So today I'm going to be doing a Foley catheter insertion. Could you please verify your name and date of birth for me, please? Okay, Anna Pawlowski, 5/5/57. All right, Anna, do you have any allergies that you'd like to let me know about? Penicillin? Okay. And do you know what happens when you take penicillin? Okay, so you break out in hives? Alrighty. Well, thank you for letting me know that. So like I said, today we're going to be doing a Foley catheter insertion. Are you familiar with this procedure? Have you had it done before? No? Okay, so what it does is it's pretty much we're going to be inserting a tube into your bladder so that we can drain the urine from your bladder for you as you were having problems urinating currently. Okay, so I'm just going to get started. First thing I'm going to be doing is gathering up my equipment. So I have my orders right here. I have my Foley catheter bag. I have some tape, some gloves, and obviously my hand sanitizer. So, alrighty. So now I'm going to be sanitizing and putting on a pair of gloves. So while I'm putting on my gloves, Anna, can you tell me, do you have any, you said you've never had a Foley catheter before, so you don't have any history of Foley catheter insertions and problems around that? You don't? Okay, perfect. That's all I wanted to know. Alrighty, so when I walked in, I noticed that her bed was in the lowest position. There was no clutter on the floor. Her guardrails were up and her call bell was in sight. And since we're about to get started, I'm going to now pull the curtains back so I can get her some privacy. And okay, so now we can begin. So I'm going to begin by raising the bed to a comfortable position for me so I don't break my back. And I'm going to now lift this blanket, Anna, just so that I can access urethral opening. But I'm going to leave it on the top for you so you don't get cold. So, just like so. All right. Okay, so normally I would be washing the perineum as per hospital policy, but for this demonstration I'm not going to be doing that. But this would be when I do perineal care on the patient prior to the Foley catheter insertion. So after doing perineal care from top to bottom, starting on the outside, going down, starting from the outside and then on the inside, I'm going to be replacing my gloves. And I will open my sterile kit. So normally you use this as a garbage bag, but I have a garbage bag right here, so I'm not going to be using this for this purpose for today. So I'll just be placing this next to the garbage bag, or in the garbage bag, I guess. Okay, so I'm just going to open this, just touching these tabs. Alrighty. So now I'm going to be implementing sterile technique, and I will only be touching the shiny part of this. There Okay, it felt pretty well. Any adjustments I will be doing after I put on my sterile gloves. I just realized I don't have room to put my sterile gloves on this time. Okay, so I'm actually going to, there we go. Okay, so I can put my sterile gloves on right here. Of course. Why is this happening to me now? Okay, so now I have put on my sterile gloves. My sterile field is still in eyesight. I can now adjust the box as comfortable for me. Actually, that's good. Okay, so now I'm going to be adjusting the sterile field right here to be comfortable. Same with the sterile drape. Okay. So now I have this. I can get closer to my patient. Alrighty. Okay, so now I have my sterile drape put in place. I have my supplies laid out. I can now begin by starting with my antiseptic. I will open this and put it on these cotton swabs like so. And now drop into the garbage. I'm doing the same with the lubricating jelly. I'm just going to put it in this here spot right here. And I'll drop and into the garbage. Okay. So alrighty. So now I'm going to be opening this. So the catheter, I'm verifying that it is closed, which it is. It has a closed system. And I will be placing that here. I'm actually just going to need to move this to be a little closer. Actually, it'll be fine. Okay. No, it won't be fine. There we go. Okay. All right, so now I can slowly remove this. Place that in the lubricating jelly. I'll just leave it here. So I'm gonna leave it right here for now. Sterile field. And now I will be opening her labia with my non-dominant hand, therefore breaking sterility. Before I do that, I'm going to attach the sterile water to the balloon here, and I'm just going to attach it and leave it here for when I need to use it, but just because I can't attach that one-handed. So, okay, so now I will be prying open her labia and using the forceps, cleaning from the outside down. The outside down. And on the other side. And the other side. And now I will be dropping my forceps along with that. And now I'm going to be asking Anna if she could please bear down for me while I insert the catheter with my dominant sterile hand. A few inches away from the tip. Okay, so I currently see urine coming out, so I will be inserting an inch or two more. Perfect. And now I'll be emptying the sterile water into the balloon. All of it. Perfect. All right. So now that I know that it is secured and flowing properly, I can now attach this part with my tape that I had grabbed when I gathered my supplies and attach it to her leg right here. Oh. The edges always get you. So I'll be attaching this to her leg so that it won't jostle that part. And then the rest of it I will be attaching to the hook under the bed. Right here, using that hook. I will attach it there. And now I can take my gloves off. Discard them. And now I can get rid of my supplies. All right, Anna, you did a great job. Do you feel any discomfort or pain at all? No? Okay, so I'm just gonna lay your blanket down. Perfect, you did great. All right, so now I'm going to just go and document what I saw when I got the urine to come out. I will be documenting the amount of urine that came out, the color, the clarity, and the size of the catheter that I just inserted. Okay, so I'm just going to make sure that the bed is all the way down, that there's no clutter on the ground, that you have your call light within reach, and that the guardrails are all the way up. All right, so I'm just gonna pull back these curtains, imaginary curtains. And if you need anything, you can always just give me a call. Can I get you anything before I leave, like a glass of water or something? No? Okay, perfect. So if you need anything, just press that call light, and I will be outside documenting. Okay, have a great day.